Hello, it's Tessa back with you for another episode of Newscast, and today we're talking Parentcraft and the lack of it. Because, as it turns out, pregnant women on the Isle of Man still aren't being offered any Parentcraft sessions in person or virtually. That's despite an assurance from the Health and Social Care Minister that new online resources would be available by early February. Claire Christian made that pledge in the House of Keys on the 28th of January after being questioned about why face-to-face sessions for expectant mothers had been stopped. She said whilst Parentcraft was essential for educating and supporting expectant parents in preparation for childbirth and early parenthood, a decision had been taken to move it online. This, the Minister said, was due to feedback from previous attendees of the day sessions, which were run by midwives on Saturdays, that a more accessible and flexible approach was needed. Mrs Christian said online videos would be scaled to reach more parents, would be accessible at any time, and useful for those not comfortable in group settings or whose first language wasn't English. She told her fellow politicians videos would include modules about labour preparation, newborn care, breastfeeding and postnatal recovery, as well as tours of the maternity and neonatal unit. Women, she said, would also have the opportunity to discuss the video content with their midwives through their pregnancy and could feedback via an electronic form to help inform and shape service delivery. She denied that the decision was a cost-saving measure and said it would be reviewed in 6 months' time. But it's now March and those online videos we've all been promised haven't materialised. And information released following a Freedom of Information request by Manx Radio shows the decision to scrap the face-to-face sessions was taken last summer. Minutes from a meeting of the Integrated Women, Children and Families Care Group on the 2nd of August 2024 showed parenthood education would be taking, and I quote, a new direction. Manx Care stated this was due to current difficulties in covering these sessions. So it's 8 months later, almost the duration of a pregnancy, and the online content which was discussed in that meeting and which Manx Care claims has been recorded internally during working hours is still not publicly available. It's something I put to Joni Farragher, the MHK who raised this in the House of Keys with the Minister.
We were told that these videos were available from the start of February, and in actual fact they're still not ready. They still haven't been prepared, which is something that I've found out since having discussed this with lots and lots of people in the community. So there's just been this dearth really of information for expectant mums. The in-person sessions have been stopped unequivocally and the videos aren't prepared yet. So there is nothing for expectant mums in this period, which obviously is problematic for the very reason itself that there isn't but it's equally problematic that the information that I was given wasn't correct. And I think we do need to be able to rely on the information that we're given in answers in the House of Keys. We should have to be able to expect that they're correct, and if they are discovered afterwards to be incorrect, that needs to be corrected by the Minister so that we have the information for our constituents.
And as you say, the videos the Minister said would be ready at the start of February. It's now the start of March and we've checked ourselves today and they are not available. So there is this gap of information. What do you think women are doing in this period where they just aren't getting that advice and that knowledge and that support? Many of these people who will be first-time parents who don't have any prior knowledge to base this experience that they're going through on.
I mean, it is absolutely unconscionable, to be honest, that we have taken this service away from women. However, we are very lucky that we have a volunteer in Jan who's set up the sessions at the Roundhouse, and I know that she's been quite overwhelmed really in terms of attendance at those sessions, which really does show that people want the in-person Parentcraft sessions and there isn't really this desire to have video sessions actually, because she has been very much into the future as well. Her sessions are filling up months ahead, so I think we're lucky to have that, but we should not be relying upon a volunteer service to provide what is an essential, absolutely essential service for expectant mums. I'm aware that we do have in-person classes for expectant dads, and I think that's lovely. But I have been made aware, I've been approached by a same-sex couple who are both expectant mums, and they haven't been able to access any of that support. And I can't understand what government are thinking in doing this, and I think we cannot let this happen. Taking this forward cannot be allowed. We need to we need to get our maternity services back.
And one of the points you mentioned there is that the face-to-face sessions for expectant dads are continuing. Now, that's something that has struck a note with some of our listeners who kind of ask the question, why? Why is it that we can provide a face-to-face service for an expectant father, yet we're providing, at the moment, nothing for an expectant mother?
It certainly seems to sit uncomfortably with a lot of my constituents and a lot of the people that I've spoken with. It does feel like it's a misfit, doesn't it? I mean, having a service for expectant dads, I think, is really nice, but it is a nice to have, whereas having a service for expectant mums is an absolute essential. The only thing that I can think of here is that Manx Care are cost cutting, and that DHSC has signed off on cost cutting measures, which they'll need to do to fit within budget. But why is it always women's services? And that, we need to have Parentcraft classes. There is heaps of research that show us what Parentcraft classes, what the benefit that they bring, and one of the main ones will be in reducing the rate of postpartum depression. Now, that to me is huge. If we have women who are experiencing postpartum depression, if we have an increase in that due to not having Parentcraft classes, that will cost us far more than just running the classes. So what is the strategy here? What is the rationale? I want to see that. Now,
the Minister, in her answer to you in the House of Keys, said this was not a cost-cutting measure. She denied that it was to do with cost. She said it was based on the feedback. We'll come on to the feedback that we've had in a moment. But actually, I mean, from your perspective, when you look at the costs involved in this, and we've asked for them, and what we've been told is that the cost of the face-to-face session for the women would have been approximately £234 per midwife. Now, the cost of the session for the classes for the dads would be £52 per midwife. So the statistics that Manx Care have given us about cost clearly show that there is a cost difference between the sessions for mums and the sessions for dads. Do you believe the Minister when she says that this isn't a cost-cutting exercise?
I think that it is often stated that it isn't about cost. I think it is my view of this situation, and I think many other people's view, that this is to do with cost-cutting, because there is no other reason that they would have done this otherwise. And if there is a reason, then why don't they tell us what that reason is? Because the feedback does not show that people actually wanted in video sessions. The feedback doesn't show that. So that is what I was told that the feedback showed, but it isn't what the feedback shows. So why else have they made that decision? Maybe if they can give us that explanation, then we can see that this isn't a cost cutting. But as far as I'm concerned, at this point, that's very much what this is.
And it's interesting because we have asked for the feedback that Manx Care and the DHSC said that they were given about moving to online. And the key themes that they've given us definitely don't say overwhelmingly that people want video sessions. There is a raft of feedback, but it says people might like it as almost like as an additional, as an add-on, something that they can look back on. But actually a lot of what they're asking for is that practical hands-on support and advice. Manx Care and the DHSC, however, say that there's lots of benefits to moving online. Do you think there are some benefits to moving some of these sessions online?
Possibly. I wouldn't like to sort of pontificate on that, in terms of, without having the information in front of me, what the rationale is and what the information that they've received is. But I think if there is this huge cost difference, then they could have looked at a hybrid model, of having a couple of hours in person, and some time for socialising for the mums afterwards. It didn't have to be midwife led, and some online sessions as well, and perhaps having just one wrap up session at the end with the cohort as well, and that could have saved them money, and it could have actually delivered for the people of the island who are expectant mums as well. And I think we probably need to start thinking a little bit more in terms of the end user, rather than how can we save money, at the bottom line always being about money. That just seems to me like what we're coming out with is things that just make life worse for people on the Isle of Man.
Once somebody's had a baby, obviously I would imagine that they're very vulnerable. Their world's been flipped upside down, probably in an absolutely lovely way. But for some people, they're going to find that period really difficult. And if there isn't sort of the support and the practical support there, potentially, do you think this is something that actually could end up costing the health service more in the long term?
100%, yes. I did mention about the in-person parent classes and just generally social classes for expectant mums being linked with reduced rates of postpartum depression. However, we also have seen the reduction in home visits. So the community midwife team's been reduced to one midwife for the whole island, and that we don't even meet UK standards, which are quite low anyway compared with the rest of Europe. The combination of not having the social classes, not having the in-person classes, and not having a community team, I think will lead to more babies not thriving, and that is based on medical stats. That is based on information that I've received from staff members as well. And having to hospitalise babies because they're not thriving is obviously going to cost an awful lot more than just running the classes and just having another couple of community midwives, so that we can increase those home visits, which are absolutely vital, in particular to people who are vulnerable and struggling.
We were approached by expectant parents who were very concerned about this. We know that you've raised questions. What would be your next step from here? I guess this isn't going to be a subject that you're just going to leave alone now. You want to see real change here.
Absolutely. I just don't think that we can, in all good conscience, allow this to go ahead. I've got my written question in when I get the response to that. I'm really grateful that you shared the FOI response with me as well, so I can see the feedback. It very much seems to me that the information that we were given in the House of Keys wasn't accurate, wasn't up to date, and needed to be checked through before it was cited. That means that there's definite grounds for following this up and finding out more information. The bottom line is we need to get those Parentcraft in-person classes back, and we need to get more home visits.
The lack of Parentcraft sessions has sparked a retired midwife to offer her own in a bid to fill the gap. The Department of Health and Social Care has acknowledged this, saying it's aware of a once registered midwife who's supporting families and delivering a programme similar to Parentcraft sessions. However, it adds it feels there's lots of information and support available to families through third sector organisations, and it's worked with these to ensure materials are up to date. But the department says whilst every effort is made to work with others, it and Manx Care are not in a position to financially support these multiple agencies. In addition, it says for sessions such as Parentcraft and Aquanatal, they would only consider endorsing a registered practitioner who was up to date with current midwifery practice, local guidelines and policies. Manx Radio has invited the Health and Social Care Minister Claire Christian and Manx Care to respond.
Thank you for making it to the end of the Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.